Fatigue is a common problem for people with SMA, and in this video, we'll break down what it is, why it occurs, and how does it affect daily life. So let's get started and learn more about this important aspect of SMA. Fatigue is a familiar issue for SMA individuals. Spinal muscular atrophy is an inherited disease affecting the muscles and nerves. Perceived fatigue and psychological fatigue are two main categories of fatigue, and both of them can take place in the body and the mind without distinction. Knowing the difference between perceived fatigue and muscular fatigue would enable a person to take care of their body appropriately. Types of fatigue experienced by people with SMA. It may be concluded that SMA patients can experience perceived subjective fatigue, which is also referred to as experienced fatigue, and they also experience muscular or performance fatigue. While persons with SMA frequently report having both, the two types of fatigue are not always related and seem to come from separate causes. First, let's take a look at perceived fatigue. Perceived fatigue is a strong feeling of tiredness and exhaustion. A rise in the perceived demand and a fall in the desire to perform the activity are characteristics of this kind of exhaustion. Certain SMA patients may believe that they are too weak or tired to carry out activities necessary for daily living. Even those who follow a healthy diet, take it easy, get lots of sleep, and lose weight may still feel exhausted. Perceived fatigue was identified in the study as one of the clinical indicators commonly reported in SMA patients. While perceived or self-reported exhaustion impacts one's strength and capacity to perform tasks, it's not synonymous with musculoskeletal or muscular exhaustion. Therefore, regardless of their level of motor and physical activity, SMA subjects may experience self-perceived fatigue. Now let's get into the details about muscle fatigue and its real-life impacts. Muscular fatigue or fatigability. Muscular fatigue, also known as fatigability, is a measured loss in muscle and motor function over time. A person diagnosed with spinal muscular atrophy may experience muscle fatigue and get involved in a brief walking exercise. But halfway through the exercise, they may experience muscle weakness or loss of coordinated motor movements. They may experience muscle failure that makes them stumble or even fall. They will be required to be held back to their initial position if they carry on with the walking. Again, unlike perceived fatigue, which is measured by the use of questionnaire, muscle fatigue can be seen and tangibly assessed, hence the term objective. Healthcare professionals apply several measures including the fatigue severity scale while evaluating fatigability in subjects with SMA. There are also signs of fatigability. For instance, one can be seen and monitored as one begins to experience weakness in their muscles as they walk, move, or even carry out other physical activities. Fatigability is seen in all types of SMA, and this implies that people with SMA suffer from muscle fatigue at all stages in their lives. There are a few ways to deal with the tiredness and sense of exhaustion that comes with spinal muscular atrophy. Let's check it out. Pain management. If pain is preventing you from sleeping at night or worsening the experiences associated with perceived fatigue, then managing pain could improve your condition. Mindfulness, meditation can be used, as well as medication, and less commonly, cognitive behavioral therapy can be administered. Speak to your doctor or physical therapist about these and any other techniques that you may find comfortable. Daily modifications. Subjective sensations or fatigue can affect a person's candidature to perform tasks. Maintaining flexibility is suggested, and based on data from Cure SMA, one should change the schedule or take certain actions to reduce the effects of fatigue on one's daily life. Due to the vastness of the topic and the large number of subtopics, it is necessary to take breaks and rest if required in order to not increase fatigue and exclude possible injuries. So how do you manage muscle fatigue? Let's find out. Medication. The search is still on for medication that can lessen a patient's susceptibility to fatigue in those who have spinal muscular atrophy. SMA-diagnosed adults and children who take the medication, Spinraza and nusinersen, report feeling less fatigued. Nusinersen in particular has been shown in clinical trials to be beneficial for both adults and children suffering from type 2 and type 3 spinal muscular atrophy. SMA patients should discuss potential medication options for clinical trials with their doctors to help lessen their fatigue. Physical therapy. Stretching and mobility activities are frequently used in physical therapy programs for people with SMA to enhance cardiovascular fitness and stamina. Working with a physical therapist who specializes in neuromuscular diseases can help you manage fatigue. Pacing yourself. As you grow more familiar with how you experience fatigability, you will have an understanding of how much physical activity you can tolerate before experiencing severe muscle tiredness. Working with a physical therapist and monitoring your symptoms to maintain your activities within these limits can help prevent muscular fatigue. Thanks for watching. Subscribe to our channel and check the links within the description to learn more about SMA.